We tune to Radio Kidnappers, the voice of Hawke's Beds, the program called Acupuncture on Air, and our pleasure as always to have on the hot seat Heiko from the Acupuncture Clinic in Hastings. How you going, Heiko?
I'm very good, Ken, and you? I see you've got your, it's not a Hawaiian t-shirt on, what do you got, an American?
Old Navy.
Oh, right, okay.
It's great.
You bought that in Hawaii, I presume?
Bought that in Hawaii.
Ah, good on you.
Have you ever been to the Old Navy stores?
No.
They're fantastic, men and women, but boy, you can spend a whole day in there. And I don't normally like shopping, but you know what it is, you know. Anyway, we digress. We're here to talk about acupuncture. Now, there's not a thing that acupuncture can't help with. I wonder, could acupuncture make me better looking?
I could try. I make a deal with you. I mean, if you see me twice a week for the rest of your life,
yeah.
and like if at the end of the session it's not working,
give me my money back. Anyway, today we're talking about acupuncture for ulcerative colitis. Doesn't sound very good, does it?
Yeah, well, you pronounce it quite well. You're doing pretty good.
A weird topic to go with your weird music.
So I suppose you want to know what it is, or
yeah.
what are some of the symptoms?
I've heard of colitis, but I haven't heard of ulcerative colitis.
Yeah, well, basically, if you think about it in simple terms, like ulcerative, you have the word ulcer, so you can imagine it's an ulcer of some sort. It's basically like inflammation and for want of a better word, infection of the large intestine, the colon. So and then it gives you various types of problems. The keynote symptom or the main symptom is of course diarrhea, and it can be extremely severe. It can be 10, 20 times a day, and even that
That's debilitating, isn't it?
They can't sleep at night because they're still getting up to the thing. And it sounds a bit gross, but it can be with blood and it can be with pus, and also very severe, that lower abdomen cramping and pain. Yeah. And
how do you get it? I mean, is it a virus? Is it bad diet? What is it?
Yeah, well, from a Western medical term, it's not that, though. Some people suspect that there may be an involvement, but they haven't found that as yet. But it's basically classified as an autoimmune disease, which basically means that for whatever reason that part of the body attacks itself. And you've probably heard about other autoimmune diseases. Yep. Sometimes you can get it with your thyroid, and then you get thyroiditis, or then multiple sclerosis is an autoimmune disease where it attacks the myelin sheath of the nerves, and you have a number of autoimmune diseases that sort of just decide to attack a various part of the body. Yeah. And
it does seem to be quite a common problem, doesn't it? And much more so now. You hear a lot more about it now than what we heard, say, when we were growing up. I mean, is it more prevalent today than what it was, or what?
Yeah, it definitely is on the increase, and it's not because their medical diagnosis testing is getting better. That it's a lot of these chronic diseases are on the increase.
What do you put it down to?
Oh, look, I mean, from a Western scientific point of view, there's so many things, and it's diet, and it's the stuff in the food, the additives, the things, more electronic things, more lights. I mean, there's so many different ideas and theories, but they haven't worked out how to slow it down. Yeah. So.
Okay, so we decided we've got a crook guts, and we know what it might be, so we go to the doctor. What's the doctor going to say?
Yeah, well, again, it is a serious condition, and what you'd find is that my patients would definitely have been to the doctor. But really, the main course of treatment, what can be offered, is steroids, and very severe painkillers, which often then cause other problems in that as well. So, but it does need to be checked. It from my understanding, it really just gets better on its own. I mean, it's like if you suffer from a migraine, the migraine will come and it'll go away and then come back. But and these things is that it doesn't go away.
Just hangs around,
and gets worse. And then of course the person is losing weight, and they're getting extremely tired and debilitated, and it could end up that, and if it doesn't, that the last sort of option is possibly surgery and removal of the bowel if it develops into Crohn's. If it develops into Crohn's disease, So, which is sort of like a severe form of ulcerative colitis. So,
It's hard to believe that something that serious could be treated, no disrespect, by putting a few needles into you somewhere. But you're going to tell me that
that's
is the
right.
case.
Yeah, because as you know, the acupuncture can treat everything.
That's right.
But also, I think in these cases, it's definitely the Chinese herbs is very important. And this condition obviously was around thousands of years ago because it was already documented in the textbooks then, in a similar way that whereas today, you might eat a bit of bad food and get diarrhea once, or it might be some really hot, unseasonal weather and you get a tummy bug and you get a bit of diarrhea. But then also they had that documented in the ancient textbooks, but then they also added that sometimes they didn't have those factors, but people just had massive, chronic, ongoing diarrhea. And the way that was described then is almost exactly to the way that you would describe ulcerative colitis today.
Yeah.
And with that, also treatments.
So are people coming to you as a first port of call, or are they going to their own doctor first?
No, definitely not. I mean, it's like, and many of my patients have had it in the past, so they've had it, and just to let you know, it tends to be more common with people sort of aged between 15 and 30, and they can't work that out, and it tends to have a bit of a higher incidence in women than men, and they don't really have any idea as to why it was that. But yeah, they've definitely been to the doctor, and often they've been through a course of steroids, and the patients will say, yeah, look, the steroids is what sort of saved me, if you like, but geez, the steroids then caused me all these other problems, and I felt sick in many other ways. And then they're sort of waiting in a time bomb, like is it going to come back again? And it's very scary for them, because then they just get a tiny little stitch and they think, oh no, is that gonna?
Yeah. You can't go anywhere, can you?
Yeah,
you can't do anything.
And so yeah, and then in that regards, then and then they'll come to me, and they'll hear about myself and acupuncture and Chinese herbs, or they've read something, found something on the internet, and then they will try to come along from there.
Now, you mentioned that the problem has been around since ancient China, and it's been treated by acupuncture or moxibustion or herbs. Now, you often talk about hot and cold. What's this one? Is this one a hot one or a cold one?
Yeah, well, again, it can be either, and often that's a difficult one to try to explain to the patient, because if you think about inflammation, it's hot, it's infection, and it's pus, it's yellow. There's got to be like heat in there. But then a common cause for this is actually cold.
Cold as in cold weather.
It can be cold weather or exposure to the cold environment, but also we say cold food, and cold food is not just a glass of ice water. It can be too much raw vegetables, because we say that they've probably been very cold, and even Western science will agree is that a diet like that really will aggravate this type of condition.
So how do you treat it with cold herbs?
Yeah, and again, you see, we have in our Chinese herbal pharmacopoeia herbs that have the property of being cold or hot, and sometimes people ask me, well, what does that mean? A hot and a cold property. And the way to explain that is like if I say to you, look, you're going to get a slice of ginger, a little bit of cardamom seeds, a little bit of cinnamon, a couple of seeds of hot pepper, and crush it up and add some hot water, you intuitively know that's a hot type of drink. Yeah. I'm going to drink that, and it's going to make me feel hot. I might even sweat a little bit.
Yes, indeed.
Yeah. And then I can also say, well, look, we're going to give you something cooling, and it's 40 degrees in the heat in the summer, and you're going to get some nice, just even room temperature watermelon, and you can feel, oh yeah, it's going to cool me down, or you got red, swollen, inflamed eyes. We get a slice of cucumber, and you put that on, you think, oh yeah, that's cooling. Yeah, intuitively, you wouldn't get some chopped up chili and put that on your eyes. You'd probably give you blisters on the eyes.
Indeed.
And it's the same with drinking these Chinese herbal medicines internally, and they have hot and cold properties. And sometimes even with ulcerative colitis, you might have a mix of hot and cold. And And for example, there people say, well, it's got to be one or the other. You can't have both, but you can. And for example, you've probably known people that who they say, oh, like if I eat, cold sore, or I have a glass of carrot juice, or I even have just a glass of ice cold lemon water, I feel sick. It's like, oh, I get it in, and it's like I'm so sensitive to that. And then at the same time they say, but then if I have a hot Indian curry or a spicy Thai thing, I feel sick as well.
Yeah.
It's sort of like it. And the only thing I can handle is like plain oats with or cheese on toast or something that's really, really simple and plain, because their stomach, for want of our diagnostic criteria, is imbalanced in hot and cold.
Yeah.
And
is it easy to rebalance that?
Well, again, it's in theory, yeah, we know what to do in terms of things. I won't say it's easy and it's quick. It definitely can take time, and particularly something with treating ulcerative colitis. It's quite a serious condition. You don't want to waste time.
Sure. And when you get to that point where you're getting it back into balance, does that mean then that we can continue with a regular diet, so to speak? So, if you fancy a bit of this or you fancy a bit of that, whereas 6 months ago before you came to see you couldn't do that. Is that what happens or not?
Yeah, look, what I have found with my own personal experience with Crohn's disease and this condition, once you do get it back under control, they more or less have to say that they've got to be really careful with what they do, and bland is best, And I mean, I've known one of my patients, and then he was fine for like 6 months, 10 months, not a single thing, he was just, but eating good food, healthy food, but simple, not overspicely and not the raw carrot juices and things like that. And then he read a thing somewhere that apple cider vinegar in the morning with some lemon juice and some honey is like going to clean, that. 1 or 2 days of that, and then almost back to where he was again. So then he quickly came back to see me, got it under control quite quickly. I said, look, I don't know why this thing. And other patients, and alcohol seems to be one of the worst ones for it. And it can be like, I was really, really good, and then I went to my girlfriend's wedding, and I just had one little half a glass of champagne, and then it just like sent her off the end again. And I said, look, I don't know why. It's just like I think you're just going to have to not have these things, and alcohol and then the extremes of the spicy stuff is definitely a no-go.
Okay, so come to you. I'm going to have herbs. Obviously, are going to be the best way.
Yeah, and I think, because you would need a lot of acupuncture, and I find that acupuncture and the herbs is the best combination. Yeah.
What about moxibustion?
Definitely, especially if it's of a cold course, and often with the ulcerative colitis, we say that there's heat in the lower part, but then there's cold in the middle. So I might use a lot of moxa around sort of like under the sternum there, warm up that area, which then balances out the heat from down in the intestines.
Could I put a hot water bottle there?
Look, you could, and you may find that helps relieve it, but a little bit. But I don't think it's strong enough to get in and actually to reverse the imbalance.
Yeah. So I guess just recapping, with ulcerative colitis, the prognosis is quite good, but when you get into Crohn's disease. Yeah,
that's. But as I said, I've had people with Crohn's disease as well that have then come to me because they've been at that point where they've been to the hospital, and they said, well, then if this doesn't get somewhere in the next few weeks or month, we're going to have to take the bowel out. Wow. So then they've ended up with coming for acupuncture and herbs and being able to stop that. So I mean, I can't sort of guarantee or say I can do it every time because everyone's different and who knows what stage they're at. So
when you say you're at the stage that you've got Crohn's and I come and see you, over a period of time, obviously not expecting a cure overnight or a remedy overnight. Is it weeks, months?
Well, at least a couple of months.
Yeah.
And that's quite intensive treatment, and then and that can get a bit of a problem for patients sometimes because I find they get under a lot of pressure from their friends and family. Just go to the hospital, go to the hospital. Yeah.
When you say quite intensive, how many times a week would it be coming to see you?
Oh, look, it'd have to be at least sort of acupuncture twice a week, and then the herbs you're taking every day. But I'm changing the herbs and monitoring the herbs quite dramatically in a few days. It's not like I can just sort of say, oh, here's this herb formula, you just take that for a month or two.
Yeah.
It's like and I'm radically changing the program, if you like. This is like you with your music.
Yeah,
it's
for
like
sure. Exactly.
The music's in the flavour this week, but by next Monday it's gone again.
It's trial and error, I suppose, because you've probably got literally hundreds or thousands of herbs to choose from.
Well, I mean, there are thousands of Chinese herbs, but like in my pharmacopoeia, if you like, I probably have about 400 different herbs, and then with that you make up the formulas. I mean, there's literally tens of thousands of combinations. And but yeah, an average herbalist, like when I used to teach the Chinese herbs at the college, by the time you finish in your fourth year, you sort of have a good understanding of about 200 herbs.
Yep.
And then as with experience and more, you might get up to 300, 350. And then there are some herbs that you don't use very often because they treat obscure, not so
ailments.
common problems.
Then you get onto Mr. Google, have a look.
No, these Chinese herbs, most of them wouldn't be on there.
Google. All right, Heiko, just about out of time. Just remind our listeners we want to come and talk to you about ulcerative colitis or Crohn's. Where are you?
Yeah, I'm in Hastings. You can go to my website, which is acu123.co.nz, and I'll stick that my website up there in the comment section of the YouTube, and then you can go to there, type in under conditions treated, and there is stuff about ulcerative colitis there for you to have a read.
And you have a very apt song for us.
Yeah, so I thought it can't be too
gross,
too bad for you. It must be at least up there in your top 50 of tolerable songs.
It is.
And it's Let It Bleed by the Rolling Stones.
Good on you, Heiko. As was a pleasure. You look after yourself. We'll talk to you same time, same place next time.
Okay, cheers.